So back in the olden days, and I'm talking early 20th century, the United States, relative to the rest of the world, had the best and the cheapest healthcare in the world. Now, health insurance was around, but it wasn't very prevalent. Most people paid out of pocket for their healthcare needs, so as a result, the prices were relatively inexpensive. For the most part, only covered catastrophic stuff. It wouldn't cover day-to-day doctor visits. But over the years, the government stepped in, and they've mandated more and more items to be put on all insurance policies, etc. Insurance coverage really grew in the 1930s because of the New Deal programs, which forced a lot of employers to not pay more wages, in fact. Because Roosevelt's New Deal policies actually put a cap on certain wages in certain industries, employers were forced to provide fringe benefits like insurance. So a lot of people said, well, you know, if I can't get paid more in wages, I'm going to get this insurance instead. Over time, it's kind of become ingrained in the American psyche that health insurance is the same thing as health care, which is not true at all. I've never been insured once in my entire life, and I'm not dead. If I were made supreme overlord, I would do my best to get rid of insurance. Is that because I'm some evil capitalist pig? Yes. No, actually, if every consumer were forced to pay out of pocket for healthcare, the cost would come way, way, way down. There are a lot of examples of clinics that actually only accept uninsured patients, and they usually cost like 1/20th of what the clinics which cover insured patients do. Optometry is one good example of a healthcare industry that actually has gone down in price over the years. Why is that? Well, for the most part, insurance doesn't cover it. The problem with the let's get people off of insurance idea is that it doesn't sell well politically. A politician can give you a card that says, you are insured, and everybody's happy. We have healthcare. No, you have a card. Unfortunately, all this does is drive up long-term costs significantly. Over 50% of all the money spent on healthcare in the United States is spent by the government. And with the ridiculous ballooning of Medicaid expenses, that's only going to get larger. You know your grandmother takes 20 pills that she doesn't know what they do. If you told your grandmother, you have to pay out of pocket for every one of these pills, I bet you she'd know what they did. But no, the government covers it, so be as wasteful as we want and drive up the demand artificially for these pills, which increases the cost, because somebody else is paying for it. For more examples on what happens when a third party other than the consumer pays for a service, see higher education, and to a lesser degree, housing. Let's go back to my food insurance example. Imagine we've had food insurance forever, and somebody says, you know, we need to get rid of food insurance. Everybody's going to say in the media, well, you want those people to not eat? No, I want those people to eat much more cheaply than they are now. Because if we were to eliminate that food insurance, the producers of the food and the resellers of the food would have an incentive to keep costs down because their consumers would be complaining about how much it costs. And there wouldn't be nearly as much wasteful spending on food because people wouldn't be wasting any when they realize, oh wow, we actually have to pay for this. So no, what we need is not single payer. What we need is first party payer.